Hi, good evening, friends. I'm Dr. Mahesh Nair, a director and founder of Nip and Aesthetics, Panampadi Nagar Cochin, cosmetic plastic surgeon. And I'm back after probably a long break. I didn't have a YouTube live or an Insta live session in between for the fact that I had been to Amsterdam for upgrading my skills, and the knowledge subset has to be updated frequently in our lines, at least. So learning new things, meeting new people, knowing new stuff always keeps the flame burning, the fire within you burning, and that makes a lot of difference in the practice. So I'm sorry I could not have any live event from there because of the time difference, but now that I'm back, we can start again with the YouTube live and the Insta live sessions. I thought of going in for a YouTube live this time because it kind of caters to a wider audience, because it's easier for you to go and search on YouTube, any kind of video. So it's like a lower face contouring or eye bag surgery or something like that, and YouTube is the place where you'll go. Insta live is more of like a didactic session wherein people interact with me, and I've done this topic already in Insta live. If you want, you can check it out on that portal as well. But YouTube gives a wider accessibility to a wider audience. So that's why even a YouTube live now. So coming to the topic for today, it is, what is it? Oh, it is lower face contouring. Yes. So in lower face contouring, what all can we think of? What exactly do I mean by lower face when I say one second. This screen is. Yep, got it. So lower face basically refers to the region of the face below the level of the nose, or below the mid face, the below the cheek level. So a part of cheeks do come into it. You have your mouth, your angles of your mouth, your lips. You've got, the most important is the jawline, what everybody looks for in the lower face. So you have your jawline, you have your chin, and as well as your neck. Okay, the submentum, what we call underneath the chin, the submentum, and the jawline, and the entire neck. So this is what comprises of the lower face. Upper face, as we all know, the forehead, the eyes. Mid face is the nose and the upper cheeks. Lower cheek and this region comprises of the lower face. And what options as a cosmetic surgeon can I give you when you ask me for lower face contouring? So that is all about that's what we are going to discuss in this YouTube live session. Okay, so lower face contouring can be accessed both ways, that is non-surgically as well as surgically, because I just counseled a couple of patients of the same case today. It's like some are in a hurry, they want quick results and no downtime kind of. Then we have obviously the easier modalities of changing stuff, like you have your fillers, you have Botox, you have threads. Okay, all these three things can be done in the OPD without any general anesthesia. It's all done under local anesthesia. You apply a skin numbing cream, and your skin goes numb, and we go in with the threads, Botox, and the fillers. Okay, so fillers we can incorporate in the chin, basically inject into the chin to make it more prominent in the entire jawline, starting from ear to ear. So the jawline becomes more prominent with a chin, with a filler. Of course, different types of fillers are used depending upon the viscosity and the G prime of the filler. So they are not the same all over. And at the same time, you can use fillers in your lips, upper lip, lower lip, the angles of the mouth. If they're down turning, then even that can be taken up with a little bit of Botox to the depressors of the angles of the lip over here, the depressor anguli oris, and a little Botox in the chin can also make the chin a little less cringed or less. Some people have got what I can say, dimpled chin, not dimpled chin exactly, but undulated chin. It's not a very smooth chin, and they want a smoother chin. So what we do is we partially paralyze, not completely paralyze, partially paralyze the mentalis muscle over here, and that makes the chin more flatter and more uniform. So Botox in combination with fillers do work over there. Also, if you need a better jawline, then yes, threads do work. So we pass the threads from here and we engage it this way to lift this entire region up. You get a better jawline as well as a better lower face. So the trio, this Trimurti basically works really fine in younger age groups, say like something from say 20s, 25s. Generally fillers, youngsters also come, youngsters only come more. So it is like 20s to 40s, roughly somewhere around in that age group. These three things do work really well. Okay, so as the age advances, your skin becomes more lax. It starts losing its elasticity and its tensile strength. It starts sagging, and that is when you need more what I can say invasive modalities to address the skin of the neck especially, and the jawline. So, and also there is fat accumulation in in the cheek, the jawline, and the neck region. So all this can be addressed in different ways. Let us see how. So one of the what I can say, yeah, are you a candidate? Well, I didn't come to that. I'm routinely asked this question, like, do you think I really need a lower neck, or I mean a lower face contouring? Yes, well, if you have a turkey neck or tortoise neck, what we call loose skin, fat, and some soft tissue over there, then definitely you need a neck contouring or a jawline contouring. Of course, genetic predilection for fat deposition is also to be taken into consideration, because some people are genetically programmed to have fat accumulating in the neck and all, and that generally occurs in the deeper planes. For that kind of a case, you definitely need a neck lift, wherein you go in deeper, you remove the fat, you readjust the tissues and redrape the skin. Then only you get a good result. So it's not like I do a chin liposuction over there, or jaw or neck lipo over there, and you're going to get a really flat neck. No, that doesn't happen that way. So that one must really be careful about. And yeah, more or less all these procedures have very little scars, because we just go in with keyholes over here and here, 2 to 3 millimeters, and contour the neck, the chin, the jawline, and all. So scars are not much of a concern, except when it comes to a facelift or a neck lift. Again, in that case, the scars are like very close to the ears. So it really doesn't matter. It conceals itself really well. They're well concealed scars. So the submental angle, yeah, double chin surgery also is a part of lower face contouring, because a double chin is a part of the lower face, and that is primarily the indication why many people come to us. So what one has to consider is of utmost importance is even the submental angle, which is your chin and your neck, where they chin and your neck where they join together. This angle, so that angle has to be recreated in some individuals, or enhanced in certain individuals for a better, more youthful look. Like when you're younger, you have this angle which is quite acute, say like 90 to 110 degrees, like in like in most cases. So if that angle becomes more obtuse, that is the time when all the problem starts, and you start noticing that, oh, my neck is looking fat, now what should I do? Of course, weight loss does help, but then sometimes, as I said, genetic predilection also makes it difficult for every individual to lose fat in the neck. It's not that easy. So that also has to be factored in. It's not always your fault, don't worry. Sometimes it is your genes, which play havoc, and you land up getting fat over there. So the bedrock, I can say, the workhorse of our neck jawline, chin jawline, neck jawline liposuction, contouring, is lipo contouring of this region. Now, let me give you a brief insight into it. We cannot do liposuction of the entire face. Okay, it's very risky. We can do, but I don't know. Generally worldwide, it is not practiced. It's very scary. Why? Because there are a lot of facial nerve branches that go, which animate the face, the facial muscles, and any paralysis over there can result in facial asymmetry. That's horrible. You can't live with that kind of a thing. So might as well, the safety line is from the angle of mouth to the tragus or to the earlobe, and below this you can somewhat safely do a liposuction. Why I said somewhat safely is because there is a nerve called marginal mandibular nerve over here, which supplies the muscles of the chin area. So your depressors and all basically are innervated by that, and so one has to be careful with that nerve. And the nerve has a little aberrant root. It is not a very predictable route. I mean, we have a margin of predictability where it may lie, but it can lie anywhere in that 2 to 3 centimeter belt. So you can't exactly pinpoint, like, look, your nerve is here and I've saved it. No, that need not happen. So one has to be very careful with this liposuction over here. Plus, the other side, the complications that can occur, wherein you get a blood clot or something like that. Though they are very rare, frankly, chin jawline lipo contouring is one of the safest procedures in our ambit, and it works really fine because it really delivers good results. Okay. So in this, what we do is we do liposuction. I prefer to do an ultrasonic liposuction, that is basal liposuction, along with power assisted liposuction for the fat. What that means is we emulsify the soft tissues and fat over here and here with ultrasonic energy, and that helps in some amount of skin retraction or skin contraction also. Also, there are other devices right now like like radio frequency, which is being delivered from within the skin to give you that effect. That also works really brilliantly. So we do liposuction of this region, and then the neck, when I mean the neck, I mean this belt, okay, till your cricoid cartilage or till your thyroid cartilage, not way below that, just till over here, which is the safety limit. You cannot go below that because there are a lot of vessels, nerves, and all over there, and also your thyroid gland is situated, plus it is too far down. That much, usually the neck becomes, a little thinner over here. It is this neck which generally bothers you because the angle matters over there, the cervicomental angle. So that is what is addressed with a chin jawline liposuction. Of course, this most important procedure of ours has some kind of a downtime. For about a week, you may have some amount of swelling and bruising over there. We also ask you to wear a chin strap. Okay, a chin strap basically is a garment, a pressure garment, which goes from over your head under your chin to help and support it, to uplift it. Okay, so that your chin and your neck and your jawline does not develop a lot of swelling, because obviously if you have done liposuction, swelling is going to follow. So you need to prevent that swelling from worsening, and at the same time you need to redrape the skin over the underlying muscle, which is the platysma, so that you get a better finesse to your result. And I would really love I would really love to see you wearing that pressure garment diligently for at least 2 to 3 weeks, 2 weeks minimum, 3 weeks maximum. That generally redrapes the skin very well over the underlying musculature, takes care of the edema, lessens the bruising, lessens the pain. Of course, pain is not that much. None of my jawline liposuction patients have ever told me, doctor, I'm having unbearable pain. Pain is not the main concern here. The swelling, the edema is. So that is something that you may feel like, doctor, will I be able to go out? Yes, going out is a concern because of the garment. But then even in migraine treatments and all, you do use some garments like that, especially when you inject Botox into the splenius capitis muscle and all. So chin jawline liposuction, that is one important procedure in our armamentarium that we can do. Then you have simpler, smaller procedures which you can add to modify the jawline. Something like fat grafting. I love fat grafting. Frankly, it all depends on the technique what you have learned and how you execute it. I mean, for the longevity of the fat, I get a lot of patients saying that, doctor, fat does not survive and this and that. I said, like, look, fat, for it to survive, first of all, it has to be grafted properly, harvested properly. The surgeon who's doing it should know what he's doing and how to handle fat, and then only fat survives and gives you good results. If you're going to maintain the same weight during your surgery, the weight which you have at your surgery, if you are going to maintain that weight in the post-operative phase, plus or minus 2 kg here and there, most of the fat does survive. Up to 70% can easily survive in the first session, especially in the facial fat grafting cases. Lips are a completely different ball game, because lips have a tendency to lose fat or filler at a much faster pace because they're constantly moving. There's a big muscle and it constantly moves. So if I was to show you a result which we did recently, I would like to show you this one. It comprises of facial fat grafting to change the lower face, the jawline, the chin, everything. All over here has been done only with fat grafting. There is no element of any kind of implant in this, and this is a very immediate result post the procedure. It has not taken much time for the edema to build in and settle, and kind of it's a very spontaneous result. So all these kind of things are possible with just facial fat grafting. You don't need a jawline implant. I'll come to the implants a little later. Not that they're bad, but when your own fat can do it for you, why not? So fat grafting also is that all these are daycare procedures, most of them. Even neck lift, frankly, yes, you can go home the same day. You need not stay overnight. Facelift with neck lift, yes, I would like you to stay back because you may develop a blood clot or a hematoma or something of that sort. So one has to be a little careful with facelift and neck lift when they're combined together. But neck lift alone, yes, you can definitely go home. All these smaller procedures like chin, jawline lipo, buccal fat removal, dimple creation, jawline fat grafting, filler, everything you can, all of these procedures you can definitely go home. You need not stay back. Okay, so it's a daycare surgery. So coming to the chin and jawline implant, yes, you can have a chin implant. It's made of, I have it here, I'll just show that also. So this is basically a sizer, not exactly an implant, but that's how an implant looks, a chin implant. Okay, so that sits over here like this, inside, of course, not on the outside. So we can put this from inside the mouth or from outside over here, taking a small nick. I prefer going from out because it is closer to the bone where I'm going to put the chin implant. I need not bolt it in place or screw it in place. We have a technique of suturing it in place so that it doesn't move, and this pocket anyway is very tight. It's snug fit so that the implant doesn't shift anywhere, unlike this region where I definitely have to like screw it down in place. Of course, there are cases where we haven't done that and it has still survived wonderfully well. There are techniques how we do that. So a chin implant, trust me, is a very safe procedure, just like the malar implant. It doesn't involve any kind of downtime. You're up and running the very next day. Short surgery, 1 hour job, and definite results, fruitful results, lasts a lifetime. Nothing's going to happen to the silicon. That's a guarantee. Okay, unless of course you meet with a jaw breaking accident or something like that. But nothing happens to it as such. So this stays with you the lifelong. So it's a result which is permanent and not permanent also. When you want to remove it, just another small surgery over here and the implant can be taken out. It's your wish. So that can be done. These wings of the implant, these wings basically help enhance the jawline, like till here. Okay, so your jawline is also enhanced over here, and subsequent jawline, like this angle and this part, if you need to enhance that, then definitely you need what are called jawline implants, which start from here and go over here. They are customized, or they can be even you can buy the specific sizes, like small, medium, large, extra large, and then customize them, custom tailor them, and get them inserted. Of course, a 3D CT face, 3D CT reconstruction of the face and all will be immensely helpful before we go in for such a procedure, because it gives us the idea of how the bone and all is and how to contour it better. So chin jawline implant is definitely a good option. I usually combine a few of these procedures together so that the best possible result is delivered. Like for example, you may put a chin implant, but fat graft over here so that your whole jawline gets it stands out. Or suppose you have a very little amount of fat over here and you're not a good candidate for jawline lipo, chin lipo, or you don't want that kind of a garment to be worn for 3 weeks, then definitely you can go in for a chin implant which stretches this chin, stretches this skin also, and gives you a more defined look. Along with that, we can do a buccal fat removal. My Instagram has those kind of results. So you can do a buccal fat removal to get this region of the jaw, of the cheek inside. So you get something like that, a very chiseled look, which is very sought after by youngsters and everyone. Frankly, nobody wants chubby cheeks as such, so they have to look a particular way. And now with the social media culture of selfies and all, of course, the angles also matter. So like many people come and say, Dr. Mike, this angle is good and this angle is not good, what should I do? So then you have to balance and symmetrize the face with either facial fat grafting or maybe with some fillers. So that's your choice. We offer you all the choices, and then you can select what you want to get, what you want to be done on yourself from that. So of course you have Botox to the masseter muscle. Yes, this is something which I wanted to discuss. If someone has a little wider region over here where the angles of the mandible are, a wide jaw over here and a very narrow jaw over here, and that is making your face look very broad, that can be altered to a certain extent, the silhouette of your face, with Botox into the masseter. Now it works with a very simple principle. Botox is botulinum toxin. Botox is the brand name, so we'll use the word botulinum toxin. So the toxin basically temporarily paralyzes some muscle fibers. It's not it paralyzes all the entire muscle. Only some muscle fibers are paralyzed, and the rest of the muscle is functional. So when I do Botox to your masseter, it does not mean that you can't chew, you can't open your mouth. Anyway, it's a muscle which closes the jaw. It doesn't open the jaw. So the thing is, you can still chew, you can still eat, you can still do everything, because there are a lot of other muscles taking care of that function. So we do Botox sequentially every month so that the effect is cumulative and your muscle starts sitting down. I've got results of that. I've even posted it as a story on Instagram. So once when this region starts going in, because the muscle goes in, we first assess you, of course, how big or how thick the muscle is, and where the jaw is exactly. If the bone itself is flared out, then yes, we can't do this stuff with just Botox. But if the muscle is huge and the bone is inside, then yes, definitely Botox is going to change your lower face and your jawline. So Botox does work. You may need about 4 to 6 sessions, which may have to be repeated a couple of months or years down the line. But more or less, the effect is kind of permanent, and it stays for a very, very long time with you, wherein your masseters have gone in. So one is that. Second is, if this part goes in and this part is out, exactly near the angles of the mouth over here, like some people have fat deposits here, then you need something called a buccal fat removal. Again, a daycare surgery, no cut on the outside. You just have to go inside, make a hole, take out the buccal fat from there. Of course, I'm making it sound very simple. It's not a simple surgery. It is something that you learn with time and experience. So you go in over there, you take out the buccal fat just enough so that it doesn't look too excessive. Like, you shouldn't look like that. You shouldn't look like a sucked in fish kind of or something. It should look very natural. So you take out just the same amount of fat from here and here. You may weigh it, or you may just see it visually, how much fat you have taken in from here and there. And that usually helps you in deciding, in getting your cheeks a little more narrower. So the angle of the jawline, the angle of the jaw, basically over here can be narrowed, over here can be narrowed. This can be streamlined and brought out to make it look more appealing. This can be made to stand out. And of course, your chin is another region which can be, like, enhanced. So that's about buccal fat removal. Then you have dimple plasty. Okay, dimple plasty is like what I can say, a crown over it all, because it's an add-on procedure which does not alter the lower face contour much, but it enhances it by creating the cute looking dimple or groove, which generally is very much sought after. So again, it's a surgery which you do from inside the mouth. You don't have to do from outside anything. It's scar free. The only problem with dimple plasty is dimples remain static for about 2 to 3 months, and then they become dynamic. What that means is, when I create a dimple will remain as it is even when you're smiling or not smiling. And after about 3 months, they start moving. Like when you smile, they come. When you don't smile, they go away. The another issue with dimple plasty is, sometimes in some cases, dimple may go away. Okay, it's not necessary that it's a permanent result. It can go away in 3, 4, 5 years or anything of that sort. Why? Because dimple is basically a defect in your musculature. It is genetically programmed. Some people have it, some people don't. When I artificially create it for you, or when a surgeon artificially creates it for you, we create a defect in this muscle. This is the zygomaticus major. You can see this thing going up. This is the zygomaticus major muscle, which helps you smile. It's a lip elevator. So the thing is, when you smile, basically this muscle, it has a differential insertion over here and a defect, such that your skin gets stuck with the tissue underneath, and then you get a dimple when you smile. It's as simple as that. The physics is very simple. That's what you recreate when you do the surgery. The only issue is, biology doesn't go hand in hand with the physics of it. So you want a dimple. I understand how to give you a dimple, but your biology states that no, this muscle will be, built up, and you will lose that depression over there. So that's how it goes. And then and then you don't have the dimple at the end of it. So that can happen. And most of these surgeries can be done under local anesthesia as well. Or if I'm doing a combo, then I prefer to give a short general anesthesia, wherein you don't trouble me, I don't trouble you. There's no pain, kind of, no ooh, ah, ouch on the table. It goes as a very smooth affair. Most are, since they're facial surgeries, they may be a little painful. That's your perception, basically. But under local anesthesia, trust me, it is not that painful. It is very effective. If very effectively done even under local anesthesia. But GA is also okay. Some people prefer it. Then side effects, yes, as I told you, sometimes the nerve gets affected a little bit, and you don't get to move your angles that easily, or your this movement and all may be a little deficient because of the local anesthesia. So all this goes away in 2 to 3 weeks. Don't worry about that. 100%. We don't sit and cut any nerves over there for it to lose its function permanently. Of course, swelling, bruising, and all do occur, but in about a week or two's time, even that settles down really well. So there's no as such downtime for these procedures, but yes, you may be socially withdrawn for some time, maybe about a week or two, because you may have swelling, you may have bruising, and of course, if you have the chin strap, so 2 weeks anyway, you're out. Please avoid smoking and alcohol, because these two things can be detrimental for your healing in the post-operative period, especially when you do a chin and jawline liposuction, where I'm expecting your body to cooperate a little more with me. Okay, see, some surgeries are like very predictable, like otoplasty. Okay, I don't depend on your body for it to maintain the result. I go in from there, I bring the ear in, I stitch it, I rely on my stitches. But here I'm relying on your skin to redrape your muscle, because of which I need the pressure garment. So definitely I need you to cooperate with me by not having these foodstuffs or these addictions, which can lead to issues in healing. Okay. Another thing that I wanted to touch over here is what many people have been asking me, doctor. I want that fat dissolving injection. Okay. So now, what does that mean? The brand name is either Kybella. Kybella is not available in India. It's by Allergan. So in India, you have got something called Geolysis. It's basically chenodeoxycholic acid. I know, a big name. Don't worry about the technical mumbo jumbo. It basically means a bile acid, and that is basically an acid which is concentrated in your bile juice, in your gallbladder. So that acid basically dissolves or liquefies fat. Now the thing is, if I inject a finite quantity in a particular region, I cannot exactly predict how much of fat is going to go from there. So we inject it in 1 square centimeter regions, and it's mainly done for this submental region, okay, wherein you don't have too much fat and you have very nice skin which can redrape very easily. So you have to be very careful in selecting these kind of patients who are ideal candidates for Kybella or geolysis or all these fat dissolving injections. It is not that everybody can go in. You can't come to me with a very thick neck and then tell doctor inject Kybella and make this neck thinner. No, it is not possible. It can't be done. So there are some scientific limitations what we have as surgeons and aestheticians. So we cannot do that. So definitely this fat dissolving injection works in the right hands. You will need about 6 sittings or so, maybe slightly more. It's not that cheap. It is kind of expensive. The results are a little unpredictable. As I said, as I told you, the science behind it is not very predictable. You may get something like cobblestoning sometimes, like there may be patches which are like deep inside, some may project outside, inside, outside kind of. So it is I wouldn't really go in for something like that when I know that my hand is very much attuned to getting better results with, say, a liposuction or maybe something like fat grafting to create more positive spaces so that your negative spaces get what I can say contrasted against them. So yes, that works in some people's hands. Of course, those who do swear by it, perhaps at times, I don't know, but I'm not very much in favor of those alternative medicines, and especially when I know that a surgery or a filler or Botox can also give you a very good result in that. So I think that pretty much summarizes the chin, jawline, lower face contouring procedures. Of course, there are bony procedures like you have genioplasty, wherein you do a bony advancement of the lower jaw. You cut the bones from here, of course, from inside the mouth. There's nothing on the outside, and you advance the jaw, or you retrude, or take it behind, or you lower it to change the shape and position of the chin. That is called genioplasty. That can be done. We do that quite frequently for facial feminization surgeries, wherein when you have a trans woman, a male who wants to become a female, and it's called a trans woman. So the thing is, trans women, when they want a little narrower chin, a little feminist chin, that is the time when we go for V-line genioplasty, wherein we alter the chin. Again, the same can be achieved with fat grafting, also camouflaging it. But bone job is a permanent job. So you'll have plates and screws over here. And don't worry, they're titanium ones, so they don't ring a bell when you go into the airports. So yeah, so that can be done. You can even do bony surgeries. Even this, suppose if your angles are widely flared out, okay, or your jawline is too broad and you want it to be a little narrowed, then yes, definitely you can undergo for something called mandibular correction with mandibular shaving. So you can trim off this angle, you can trim off the width of the mandible, that is the bone, the lower jawbone, and hence you can alter your jawline. Also, what you can do is you can alter the height of the jaw. You can even alter the musculature called masseteric shaving. So those who don't want Botox into the masseter, and your masseters are really too large for even Botox to work, then you go from inside the mouth and you do masseteric shaving. That is, to shave off certain muscle fibers of the muscle, and then it's all from inside. So don't worry, nothing comes on the outside. We go from inside and we do all this stuff. But that's a little extreme surgery for something like a lower face contouring. I'm not saying that it's not done or it can't be done or it is something detrimental, but your case should merit the surgery, in the sense it should be worthwhile. The effort should be worthwhile. The time, the energy, the money, whatever you spend should be worth it, and your result should come, and not such a heavy price where you pay, like, your jaw is finally contoured but it doesn't move that well. There is asymmetry. We don't want that to happen. So technically, be very careful in choosing your procedure. So mainly choose a good surgeon who knows what he's doing, who knows what he's offering, he or she is offering, and swears by it, stands by it, has done these procedures, shows you results that, look, I've got these results in previous people, and I can deliver this kind of a result in you. And then yes, definitely, once you choose the proper person, you can go in for the proper surgery or the proper procedure, maybe a filler Botox, and get that thing sorted out. So I think that sums up pretty much lower face contouring. And if you have any doubts, please feel free to ask in the comment section below. We have even our numbers mentioned. Get in touch with us, call us, or email us, whatever, and I'll be more than happy to answer all your queries. Thank you for now. Thank you for listening and joining in, and I will come up with something more interesting shortly. Okay, take care. Thank you so much. Bye bye.